Hi, everyone. I'm Gary Summers, and welcome to the audio edition of Mind, Body, Soul. I have with me another interesting guest today, Sandra Hewitt Parsons. Welcome, Sandra.
Hi, Gary. It's nice to be here.
Sandra, your topic is going to be drawing on the healer within. And I guess before we start, one of the things that it would be great for everyone to understand, and I guess a lot of people don't understand, is we all have the ability to heal from within, and
Mhm.
everyone draws on different resources, but sometimes we tend to look outward and think that we don't have the ability to do this. So before we actually get into the core of your presentation, can you give listeners an idea of what they can expect to hear from you today?
I'm a professional art psychotherapist, and I'm being trained in and waiting for acceptance for the exact credential. That's the expressive arts therapy, trauma informed. And I want to talk about a little bit about what art therapy is, what expressive art therapy is, because since I've been here for the last 8 years in my private practice in Corner Brook. There's been some misconceptions and people believing I'm one thing and sort of getting disappointed or getting really relieved, depending on the person, when I tell them, like, no, that's not quite what I do. So
you're here to set the record straight.
Trying to, yeah.
So what's the difference in creative art therapy and expressive arts therapy?
Creative arts therapy is just like one specialty. Like before I became trained as an expressive arts therapist, I was a creative arts therapist focusing on art. And there's like all kinds of, like, you can focus on music and become a music therapist. You can focus on drama and become a drama therapist. You can focus on dance and become a dance movement therapist. That's creative arts therapies. Expressive arts therapies is using two or more of these modalities in the same session. So if I wanted to, if a client came to me and wanted to sculpt and make a storytell around a sculpture, or make up a song around a sculpture, that's what I could help them with. Or we do a lot of stop motion animation with little kids who come to me. They make up like clay figurines and do the backgrounds and choose the music and make up a story of their own choice.
So is the objective to get people, kids, adults, to learn to constructively get in touch with their emotions and feelings?
Yeah. And a lot of people I see are going through chronic stress. And for the last few years, COVID has played a huge part in it. If you weren't going through chronic stress before,
yeah,
you would be now. And many people have been through traumatic experiences in life. And sometimes, we all know that talk therapy is great, but sometimes people can't find the words to describe what happened to them, or words are not enough to, actually process what happened to them.
Sure.
So that's where I come in. I like to call my approach a hands-on approach. It's not that we don't talk. It's more so that we use our hands. We use our whole bodies for expressing what happened, or their emotions, or how they feel about it, or
so because really the core of all healing really is to get in touch with your emotions, isn't it, and your feelings. And when you don't, and I always say this to people, if you don't feel right, then you're not in balance, and you need to figure out what's wrong. Maybe you're hanging around with the wrong people. Maybe your direction in life is not going the way it should be. But let me ask you this question. We'll get deep into this now.
Okay.
So isn't all everything art therapy? Why do I have to give money to a therapist when I can just stay home with a coloring book?
Well, that's a very good question. And that's a very common question. I get asked that all the time, like, oh yeah, I do art therapy all the time because I do a coloring book or whatever. If you can stay home and do coloring by yourself and feel de-stressed with it, that's great. Go for it.
Yeah.
I'm not downing coloring books. Actually, I love coloring books myself. And painting and stuff on my own. But if you feel like you can't focus, if all these intrusive thoughts are entering your head, or if you're getting triggered by what we say a bottom-up system, which starts with the senses and goes up to the emotions, and finally it's your logical brain, your verbal brain. If you go out and get triggered by like a sight or a sound or a smell, maybe, you want some support surrounding that. That goes beyond coloring books.
So I guess it's, and I asked that question. I didn't really, I was kind of joking when I answered the question, but I guess it's kind of like guided meditation where, or a lot of people say, well, punching a pillow is really good, but it doesn't really get at the core of the problem. If you can take a break and do some coloring, but if you don't guide yourself in the right direction, or if you don't have a therapist like yourself, who knows what they're doing to be able to get you unstuck, and you don't deal with the problem, then that trigger will always bring you back to the source of the problem, right? You need to get at the source of the problem, and that's where your therapy comes in, is to get that person unstuck so that the triggers that caused them to go back don't cause them those problems anymore.
Yeah. I mean, I'm like, clients come in to my office and I ask them, how are you? And they say, I'm fine.
Yeah, exactly.
But that's what you're supposed to say.
Yeah.
But, once we get down to the hands-on part, they find that, it brings up a lot of feelings and emotions and, stuff they got to process that, maybe on top they're fine, they're feeling fine, but down under, with all the sensory input and the emotional stuff that they're holding back, that's what needs a little work.
Yeah, and that's the issue, isn't it? The withholding of those feelings and emotions, thinking that you're strong enough to deal with it yourself when you're not. So you talked a little bit earlier about left brain verbal. Is it more difficult? So for our listeners, we have a left and a right brain. Our left brain is our logical brain. It's the one that creates words and sentences. Our right brain is our creative brain. It's our imagination. So is it more difficult to help a left brain person as opposed to a right brain creative person to work through this process?
I would say it's harder to work with a creative person, really, because a creative person comes in, knows what the creative person can use creativity as a mask, just like the person who comes in and says, I'm fine.
Sure.
Without really digging down into, okay, what is it I made? What does that say about me? And Yeah, that's
So it doesn't matter whether you're a logical thinker or you're an emotional thinker. You can help people work through those problems. I guess that's really what I'm trying to come down to in a roundabout way.
I think it's more like a connection between the logical and the emotional, rather than having one or the other, because a lot of people are logical thinkers. You get some who are creative thinkers, and there's like always an imbalance of one side or the other.
And I think that's the issue when you can get somebody to have that information flowing back and forth from your left and your right brain. That's when it starts to function. That's when it starts to function properly. So what's the difference between what you do and creating art with another counselor or even say a social worker?
Well, this is like if you find creating art with a social worker or counselor or teacher or artist is meeting your needs, that's great. Social workers, counselors, teachers, any other mental health worker in the community doesn't necessarily have the specialized training that I do.
Okay.
So you can color with a social worker or a nurse. They usually use art therapy as a description rather than like a full-time profession.
Okay.
So yeah, they do. Like I've heard of social workers making soap and calling it art therapy, and nurses making little, pictures with their patients to calm them down. That's great, but it's not quite what I do.
So would that be more of taking the person away from the situation as kind of more of a distraction to try and calm them down, but not really getting at the core of the issue?
Yeah. I've heard nurses and social workers and counselors and teachers calling it a distraction more.
Right.
So.
Right.
This is the thing that we're going to do, whatever.
Yeah.
And a lot of people will come in and say, well, I'm not creative. I'm just, here because, I was on the waiting list for
Yeah, sure.
therapy.
Yeah.
But you don't have to be creative to see me. I was an artist before, and then an art therapist, and now an expressive arts therapist. I can guide you through creatively what you need to do. All you need is like hands and a body, and we're good to go.
So how can art tell me something about myself that I don't already know?
Well, that's another good question. A lot of people think with like left part of their brain, top of the brain, logical part of their brain. And if the logical part of this goes back to I'm fine.
Exactly. Yeah.
Yeah. Did you ever hear of the book The Body Keeps the Score, Bessel van der Kolk?
No, but I read a book called When the Body Says No, which is probably something along those same lines, right? Which is to be able to, again, deal with the core of your being, or,
Yeah. When we go through experiences, it's not only our minds that remember it, it's our bodies as well. So that's why when you enter a certain place that you haven't been in a long time and you smell something and it brings back these a lot of memories, like it might be a good thing.
Yeah.
And it might be totally horrible.
Right.
Depending on what kind of memory it is. You mightn't have a verbal memory of it, but smelling something or just like feeling something or being in an environment where you haven't been in a long time might be enough to trigger like a panic attack.
Sure. Yeah.
So, yeah.
Tell me about the connection between expressive arts and mindfulness. Because we hear the term mindfulness, you have to be mindful. You have to live in now.
Yeah.
So talk about that connection.
Well, I like to work with clients, and I'd say from the bottom up. And it's a very body focused modality I do. And mindfulness is sort of the same thing. It connects you with your body. If you're thinking about everything outside, or what you did last week, or what's coming up this week, or experiences with your significant other, and filling in, oh, I should have said that, or, even writing a grocery list, or if all of these are going on in your mind at one time, you're not really concentrating on the here and now. You're not really concentrating on what's happening in your body. So I'd like to incorporate mindful techniques, especially with new clients, because they're not used to coming back to their body, even if they come in and say, well, I want to talk about this certain specific thing. When they talk about it, again, it's like a body thing. If they hear it, they might become triggered again. So I take them through like body scan, guided visualization. I have several soundscapes that I play in the office. I encourage them to go out in nature for some time, because that being in nature and feeling the soil underfoot, and hearing the birds, and smelling the grass and the trees, and is really grounding.
Sandra, obviously talking to you, you seem to have a real passion for this. Can you give our listeners a little bit more about your background?
Well, I grew up here on the West Coast, and I've always known that art is healing. I had a major stroke when I was 8 years old.
Wow.
And for a long time, I couldn't talk, or I couldn't walk. My control was very limited in what I could do. And actually, I thank my dad for introducing me to art, because he was a graphic artist here in Corner Brook at the university. So he would take me home these big sketchbooks and paper and pastels and markers, and whatever he saw that he thought I'd like. Well, I shouldn't say just me, because there was my brother as well. But seeing that, like, big sheets of paper, gave me back some control that, okay, maybe I can make a difference. Like, this is just like white paper. What am I going to put on it? And that really gave me back that really empowered me. That really made me feel good.
And I think one of the messages that I'm hearing from you is that people really have more control over their lives than they give themselves credit for.
Yeah. And it's, I think it's natural, going back thousands of years ago, millions of years ago, when we were cavemen, just to look for the negative, look for the next beast who was going to kill you. So, you're always on alert.
Yeah.
We don't have to worry about like beasts or, cats or, enraged dinosaurs or whatever. I know the dinosaurs weren't alive when people were alive, but
Yeah.
Enraged animals anymore. But we look for the worst possible scenario and then go back to survival mode. Well, what can I do to avoid it? What can I do to stop it? What can I and they sort of forget, okay, we have strengths too. We have abilities too. So,
and it doesn't, your brain doesn't know the difference, even though there's not a tiger behind you wanting to eat you. If your brain thinks there's a tiger behind you, or if your brain imagines some kind of catastrophe that may happen, then your brain is going to go into that response mode as if it's actually really happening to you.
Yeah.
And that's the thing that people need to be very careful about, the thoughts that they have in their head, whether they're they're actually really happening or whether it's just their imagination. Sandra, you say you're in Corner Brook. Can people take advantage of your services remotely?
Yes, I've seen people from all over Newfoundland and Labrador. I've seen people from Nova Scotia and Ontario and Alberta, BC. So yes, people can contact me wherever they are.
Okay, and all your information, for those of you who are listening to this, all of Sandra's information is displayed there as we listen to her. Sandra, we're almost out of time. And firstly, you're welcome to come back at any time to talk about what you do. But can you leave our listeners with some little bit of advice that they can use right now to help them through this, path that we call life, to make life a little bit easier for themselves?
Yeah. Well, what I always tell my clients is when you notice that your panic is mounting, or your thoughts are becoming like wild and just jumbled, and just take a step back, and we're going to do bottom up techniques again. Focus on your breathing. How are you breathing right now? If you're almost to the verge of panic, our bodies take over, and you're breathing. Most people breathe very shallow.
Mm-hmm.
When your mind is on everything except what's going on in your body.
Mm-hmm.
So take a deep breath in through your nose and hold it for about 2 or 3 seconds, and let it out through your mouth. And see how that feels. And do it again. And hold it. And let it out. And try to imagine that every time you're breathing in compassion and peace and the joy that the universe holds for you. And try to imagine it going past your nose, past your nostrils, down your throat, into your lungs, and feel it filling your lungs. And try to imagine it going from your lungs, filling up every cell in your body. And when you breathe out, you're breathing out compassion for the universe, for the people you love, for the spaces that surround you. And I hope that helps.
Well, it certainly helped me. I feel like I'm getting therapy every time I talk to the wonderful holistic wellness therapists that we have right here in the province. Sandra, thanks very much for taking the time out of your busy day, and we really appreciate you coming and talking to us.
No problem. It was enjoyable. Thanks, Gary.